now. So welcome to It's Worth a Shot today. We are going to cover the influenza honor roll, the vaccine consent forms, emergency preparedness, and after action plans. Next slide, please. As always, we just want to let you know that some of the content is provided by outside sources, and that does not mean that we endorse or recommend it, but just a heads up on that. Next slide. Okay, so for the series, we just wanted to let some people know that if you have saved the It's Worth a Shot series in your calendar, some of them had a deadline arbitrarily of November 1st. So you might need to look at your calendar and see if you need to update this. So this is an example of Outlook. And so if you open up the calendar invite, you can look under reoccurrence there. And the first step you see on that second line, it says that it's effective until December 25th. This is mine because I've already updated it, but I did have an expiration date of November 1st. So if you do need to change that, then you'll go to step number 2 and you'll see that recurrence button. And you can go ahead and click that, and then a box will open up. And that is where you can see this appointment recurrence, and you can change, make sure that the start time and end time is correct. I'm in Alaska, so I have the Alaska Standard Time selected, but you might need to select your area. And then down at the bottom, you'll see the range of recurrence, and you can either do end by and select a date, which I picked December 2024. You can do end after a number of occurrence, or you could just say no end date, and then go ahead and save that. And I'm going to share my screen real quick because there's another easy way to update that as well. And you all should have received It's Worth a Shot reminder call. I hope you can see my screen here. It comes from Mountain Pacific. And if you scroll down to the bottom of this, you'll see that it says add to calendar, add to Google Calendar, add to Yahoo Calendar. So you can go ahead and add the invite again, and it will extend that for you. So we just wanted to give you guys those options. Mary, you can take it back over now, and to just have you go ahead and look. I see there is something in the chat here. It says, as long as it's set to the time that you are currently in, then it will update with the daylight savings or lack thereof for daylight savings. So just make sure if you do go to the appointment recurrence and the box pops up that you have your state or your time zone selected. We can go to the next slide. Okay, we just want to remind everybody that the National Drug Take-Back Day is occurring on Saturday, October 28th. Sometimes they do not update the list of where the take-back is, sometimes they update the list of where Drug Take-Back Day locations are up to the actual day. So I suggest that you keep this link here, and you can go ahead and click on it, and then we'll ask you to enter in like your zip code, and it will give you this locations where medications can be dropped off, where they will be safely can't think of the word, but disposed of. There we go. Let's go to the next slide. We have a couple events and reminders for you guys. So National Overdose Prevention Leadership Summit, it's a free summit that will be on the 16th and 17th of November. You can go ahead and click on the link there to register. We also wanted to remind you of our collaboration with other QuinnQIOs. On November 17th will be session 3. And if you join us for that, we'd really appreciate it. It will go through June. And then ongoing information, there was a 3-day summit in Alaska that had a lot of really good presenters that we thought might be worth a look. So if you want to access the slides and the presentation recordings, you guys can go ahead and do that. And it had some really good content there. Next slide. We also wanted to point out that we do have a podcast going on with Dr. K. I'm sure you guys have heard him on It's Worth a Shot before, and he's going to cover all different kinds of topics. But we recommend that you guys maybe click in there and watch some of his podcasts just to get the Q&A with Dr. K. So next slide. All right, and again, we want to thank everybody for joining us on the webinar. There will be an evaluation put into the chat. We really appreciate it if you could fill that out for us. We do get really good content back, and it helps us steer topics that we're going to have, and also make corrections, as if you were on a couple weeks ago, to content that we might have that we did incorrectly. But again, we thank you for joining us every Wednesday, and if you can fill out that evaluation, we really do appreciate that. Do we have a There we go. All right. Does your facility keep Narcan or naloxone in the emergency kits? Yes or no? Sorry, I didn't finish that sentence. So I was going to say, do we have a polling question today, which we obviously do. All right, looks like most people do. That's great. Give it a couple more seconds and then we'll have Mary end the poll for us. Thank you, Mary. And can we go to the next slide? All right, I'm going to hand this over to Kyla, who will be going over our COVID snapshots for the week.
Thanks, Miranda. Thank you, everybody, for attending today. So we are continuing to see the downward trend kind of in our early indicators, but some increases in our severe indicators of COVID activity, so hospitalizations and deaths. Oh, I'm sorry, it says, well, the line looks like it's going up on hospitalizations, but it says it's going down. So just continue to keep an eye on that in your communities. Go to the next slide. Ooh, the poll keeps popping up on my screen for some reason. We can go to the next slide, Mary. Okay, yep, this is our maps where we can see where we're having increases and decreases. It's really kind of a mixed bag here. As you can see, Alaska is like half and half, substantial increase, substantial decrease, kind of mixed in Montana, more decreases in Wyoming, and substantial increases in Hawaii, it looks like. Go to the next slide. So we did have a question that came up, and I think we just wanted to make sure that folks are aware that you can get your COVID fall vaccine with your flu vaccine. Several organizations of authorities say that that is okay. You want to make sure you do different injection sites if you are going to do 2 in the same day. And the other thing that I would tell folks is that you might have a higher occurrence of side effects because you're getting two vaccines in one day. I know that my parents got them both in one day, and they said they did feel pretty horrible the next day, just with kind of feeling fatigued and headache. So just give your residents that warning if you are administering them at the same time. We can go to the next slide. So this is something that I ran across, and it's called the Influenza Honor Roll. It's a program through the immunize.org, which is an ACIP website that has a lot of really good vaccine information and resources. And I'm actually wondering, Mary, if I can share my screen, because I just wanted to show you kind of their homepage. Basically, so as many of you know, we give out safety and quality awards at Mountain Pacific to the facilities that we work with.
Kyla,
And
sorry,
so,
you're not seeing your screen if you're sharing.
oh, sorry. I saw somebody's picture. Hello, whoever I saw. Oh. What are you guys seeing? It says whiteboard on my screen.
Yeah, we're just seeing a white image.
Here, let's try this. Sorry, you guys. Okay. Now are you seeing it?
Yep, now we've got it. Influenza vaccination honor roll. Thank you.
Yeah, so this is just a nice way if your facility has mandates for staff flu immunizations to get recognized on a national level. And on this page as well, there's an application process you can go through. There's some requirements, obviously, that have to be included in the components of your mandate. But there's also some really good like position statements from some different authorities like the American Academy of Family Physicians. I believe there's a nursing group. I think it's we've got the American Hospital Association, the American Nurses Association, just kind of giving their position statements on implementing these policies. So I think this is something that you might want to take a look at and see if it's something that your facility might want to pursue. And I will stop sharing now, and I was gonna go through and show you which facilities in each of our states have already received this honor. And we can go to the next slide, Mary. We can actually skip the slide with all the text on it. Basically, it just says that there are certain requirements, such as using masks and having your vaccines documented in a certain manner, et cetera, et cetera. So these are the Alaska honor rollees, and you can see the date that they joined with their policies that they implemented. We can go to the next slide. And we do have one of our long-term care in Hawaii listed on here, so I wanted to highlight that, and also one of the hospital facilities. I really like the pictures that Calms put in here for us. Kudos to them. We can go to the next slide. So here's our Guam honor roll. We have several locations there as well being recognized, which is cool. We can go to the next slide. And here we see our Wyoming, multiple locations in Wyoming. And I don't think there was any nursing facilities currently, but if there are folks that want to pursue this in Wyoming, I would definitely encourage you to do so. We can go to the next slide. And a lot in Montana. Whoa. One of them being a long-term care facility. So congratulations to you folks there. And I would highly consider that you look into some of those position statements from the organizations that do support this policy. And I think this is where I'm turning it over to Callie. Just the resources slide has a link to that website, which I showed. So thank you very much. And Callie, I'll let you take it away.
All right, thanks, Kyla. I did go ahead and plug that link into the chat for you guys as well. I think there was a request for that. Let's go ahead and go to the next slide. Just my title page here. As Kyla mentioned, my name is Callie Perkins. I'm one of the account managers for Mountain Pacific. Let's go ahead and go to the next slide. So a couple of weeks ago, we showcased some of our resources. One of the resources that we've had for a while now is the multi-vaccine consent form. We did make some changes here recently and have updated that. And I just wanted to go through that resource. There's a lot of confusion because it is two separate forms. And I wanted to kind of explain the difference between the two forms. So the first one is eligibility. The first one is designed to look at which ones the resident is actually able to have in the moment versus consent. So which ones are they consenting to? So let's go ahead and go to the next slide. And this one actually showcases the vaccine intake and the annual consent. So this one would be the one that you would give to the resident, patient, family member, and they would identify which ones they are interested in receiving. It goes over all of the risks, and this is a standing consent form. So this would be something that you would keep on file. This one, they can identify more than one vaccine at the time. So again, which ones were offered and declined, which ones they accept and would like to have if they're eligible at the time. So let's go ahead and go to the next slide. And this one is the one that will actually capture their eligibility at the time of the actual administration. So the resident may identify that they want to receive an influenza vaccine on their consent form. So on the standing consent, it'll say that they want their influenza. But at the actual time of administration, maybe they're sick and maybe they're not eligible to receive a vaccine on that day. So it's kind of a twofold process. So you would just need to come back, on another day where they're feeling better and reevaluate their eligibility at the time of administration. So side one of this form has the screening questions, and then let's go ahead and go to the next slide. And this is side two of that form. And this one actually identifies which vaccines were administered that day. And then you're able to capture the brand, the location, the lot, and then the immunizer. So if the resident is receiving more than one vaccine, maybe for some reason they received, one from Kyla and one from myself, then Kyla would have a spot to document, and then I would have a spot to document. Again, this form is designed to be used just for one day. So if they receive influenza, but then come back a couple of days later or a month later and get their pneumococcal, then you would have a separate form where you would go through the eligibility questionnaire and you would document the actual administration of the pneumococcal vaccine. So if you guys have any questions on this, don't hesitate to reach out, let me know. Like I said, I know it's kind of confusing, but we just wanted to make sure that we clarified some of that for you guys. So let's go ahead and go on to the next slide. So some of the other resources that were showcased were our emergency preparedness resources. And so we wanted to do kind of a brief recap on this. So we'll go ahead and skip into the rules of the emergency preparedness plan. With the long-term care facilities, they must have a emergency preparedness program that meets all of the requirements of this section. So if you guys are having questions, you would like technical assistance, just know that Mountain Pacific is available, and that's something that we can assist you guys with. So let's go ahead and go to the next slide. So with the emergency preparedness plan itself, one of the areas that you guys need to focus on is going through all of the potential hazards that may impact your facility. Make sure you guys are collaborating with any community partners, whether that's fire, EMS, your local hospitals. So make sure you guys have their input. I'll give you an example, a quick example. One of the local nursing homes was planning on moving all of its residents over to the hospital. Well, the hospital wasn't aware of their plans to evacuate to the hospital. So that's something where you guys want to make sure you're collaborating and have that outlined in your plan before an actual emergency happens. Something to take in consideration is the population that you're serving. Do you have an ambulatory population, or are most of them bedbound and going to need additional assistance for evacuation? You want to make sure that you know what type of services you're going to be able to provide in the event of an actual emergency. So are you going to be able to maintain, oxygen and some of those other things in the event of an actual emergency? So make sure you take that into consideration during your planning. And there's some great resources and tools that help you identify the hazards and help you prioritize which ones you should focus on and which ones are more probable when you're doing your emergency planning. Let's go ahead and go to the next slide. So from your planning, you're then going to develop your policy and procedure. Within that, you're going to look at the roles and responsibility of individuals within your facility that are going to serve those ICS roles and responsibilities. So you'll have your public information officer, your incident commander, who's going to take the lead on that incident, who's going to convey information to your residents and to their family members. So those are roles that you want to make sure that you have identified. One area that I see a lot in especially small facilities is you have, maybe 4 or 5 key people, and it's hard to make sure that you have enough bodies to fill all of these roles. So you want to make sure that you're identifying staff who can step into these roles and know what the expectations of those roles are. If you have somebody who is very shy, probably not the best person to have as your public information officer. Make sure it's somebody who can get out there and get the message out and feel comfortable talking about the actual event. Make sure that you have the specific individuals, and if they are not available in that moment, who can step in and fill those roles as well. Again, with small facilities, that's hard. Sometimes you have one person filling some roles and responsibilities within the facility. So you want to make sure that they're able to effectively manage all of those kinds of things. So just take that into consideration as you're developing your policies and procedures as well. So let's go ahead and go on to the next slide. Now, one of the most important pieces of emergency planning is actually testing your emergency plans. So you're going to review your plans annually, and then you're going to make sure that your staff actually know what's in the plan and that they know what roles and responsibilities they serve within the plan, and that they know where to find them, where to evacuate your residents or your patients. So doing those drills is really important. So a couple of reminders about drills is they need to be unannounced. You need to at least do a couple unannounced. You should be doing a full-scale drill, and then you can do tabletop drills or an actual event. Now let's talk about actual events for just a minute. So if you have a water leak, I think one of our facilities here in Wyoming recently had a water leak, and they had to evacuate an entire wing of one of their units. So you can use those actual events as a drill, and then go through and you're going to want to review it. So we're going to talk about the after action reviews right now. And just to kind of give you guys a heads up, surveyors are making sure that you guys are doing your drills, but not only are you doing your drill, but you're actually going back and doing your after action review. There's no point in doing a drill if you're not learning from those drills and making improvements following the actual drill. So let's go ahead and go on to the next one. Okay, so on the after action review, so you're going to sit down and you're going to go through the actual, if you did a tabletop, if you did an actual emergency, if you are doing a full-scale exercise, and you're going to document who was involved, you're going to walk through the incident, and then you're going to identify any issues or areas for improvement during this. Now, the important part, as I mentioned before, is that you're identifying those areas for improvement, but then you're also creating an action plan for how to improve those. So maybe you had an emergency and your staff didn't respond in the way that they should have, or you didn't get enough staff to respond. So one of the items that you would want to identify for improvement is staff response. Maybe the notification system didn't work, maybe the alarms didn't work, or maybe they couldn't hear them in the location that they were at in the facility. So you'd want to kind of dig deeper into why the staff didn't respond. Oftentimes, sometimes we get alarm fatigue and staff don't respond to alarms the way that they should. They're like, oh yeah, the alarm goes off all the time. So again, something to look at and identify for improvement. Again, I cannot stress this enough. The most important part of doing these drills is identifying areas for improvement. And then if you need to make policy change, provide remedial education to staff, maybe you need more signage, maybe it's actual facility updates or changes that need to occur, such as the alarms or the notification systems. So whatever the case may be, make sure that you're making those changes and taking credit for those changes as well. So document who was involved in the drill, and then document all of your action items, and then include this in your quality assurance. Say, hey, we had a drill. These are the areas that we identified for improvement. And then again, just by doing the quality assurance performance improvement on this, you'll see those changes occur. So our last slide here, let's go ahead and go to the next one, is just our resources. Again, I included the vaccine consent. We have all of our quality improvement tools and resources. Just a reminder about the emergency preparedness regulations when it comes to CMS. We've included that guidance in there as well. And I'm going to go ahead and drop all of the links to our emergency preparedness resources again into the chat. And we can also include those when we send out the slides next week. Do you guys have any questions on anything? I know we went through that rather quickly, so I just want to make sure that you guys have the opportunity to ask questions. Again, Mountain Pacific is available for technical assistance. We also have all of the different resources. So don't hesitate to reach out if there's anything we can assist you guys with. Okay, I'm not seeing any questions. So if you guys do not have any other further questions, please take a moment, as Miranda mentioned, to fill out the evaluation. We appreciate your feedback. It looks like there was a question about how many drills are required. So on the drills, and I can include that, the very specific guidance on that. I believe you have to have at least one full drill every year annually. And then I don't want to tell you guys the wrong thing, so I'll make sure that
you can add that to next week's questions and answers, so that we have all of it at the beginning of the webinar.
Yeah, let's do that. And then I can make sure that we have the specific guidance on that. I can tell you off of my memory, but that's big. So we'll get good guidance for you guys and get that sent out. All right. Well, thank you guys for hopping on and joining us today. Again, we appreciate your feedback, and we will see you guys next week on November 1st.
We'll be covering pain management strategies for people living with dementia, and we'll have an outside presenter, Dorothy Colby, will be joining us to go over that. So we hope to see you all next week. Thank you very much for joining us.